Many parents whose prenatal screening indicated potential risks often face a crucial question. Should we opt for amniocentesis or non-invasive prenatal testing (NIPT)? While the final decision ultimately rests with the family, it's very important to understand the difference between these two tests before making an informed choice. After subscribing in my channel, let me explain. Amniocentesis is a diagnostic invasive test performed by collecting a sample directly from the fetus. During this procedure, under the guidance of ultrasound, a very thin needle is used to withdraw 10 cc of amniotic fluid, the fluid surrounding the fetus. This fluid contains fetal urine as well as various fetal cells, including skin and urinary tract cells. These cells are then cultured in the laboratory for more analysis. The tests conducted on these cells fall into two categories. First category contains rapid tests such as qF-PCR, MLPA, and FISH. Second category contains karyotype analysis, which provides a comprehensive view of chromosomes, but takes longer to be available. Amniocentesis is 100% accurate, and the initial results from the rapid test are typically available within 3 days. This test could be performed from the middle of the 15th week of pregnancy, but in my laboratory, we prefer to work with the samples that are gathered from the 6th week of pregnancy. Amniocentesis, because of its invasive nature, has a very tiny risk of miscarriage, approximately 1%. On the other hand, NIPT is a non-invasive prenatal screening test that requires only a blood sample from the mother. This test analyzes free fragments of DNA that are present in the mother's blood, some of which originates from the fetus and are released in the maternal bloodstream through the placenta. NIPT is not a 100% accurate test, but it has a very high rate of accuracy, about 99%, making it an excellent screening tool. This test could be performed as early as the 10th week of pregnancy, and the results take around 10 days to be available. Amniocentesis is a 100% accurate test. The initial results are available within 3 days. This test could be performed from the middle of the 15th week of pregnancy, but this test carries a small risk of miscarriage, approximately 1%. On the other hand, NIPT is not an invasive test and doesn't carry any risk of miscarriage. It could be done as early as the 10th week of pregnancy, but it's not a 100% accurate test, and the results take around 10 days to be available. I'm eagerly waiting for your questions through comments.